The National Diabetes Statistic Report of 2014 states in 2012, 29.1 million Americans had diabetes, which is 9.3% of America's population. According to the University of Maryland, the Medical Center in 2012, diabetes is widely recognized as one of the leading causes of death and disability in the United States. The Centers of Disease Control and Prevention recognize diabetes as the 7th leading cause of death in the United States. Today I will be giving you an overview of the disease diabetes. Does anyone here know anybody with diabetes?
Yes.
Like you, I know people who have this disease as well. Actually, my father and several of my aunts and uncles have this disease. There is much to be learned about this disease, on how it is caused, the types, and prevention if at risk. This condition occurs when there is high glucose levels in the bloodstream. Some of you are probably thinking, what is glucose? Glucose is simply converted sugar in one's metabolism. Managing blood sugars takes place in the pancreas. This is a flattened gland that is behind the stomach and is a vital role in the digestive system. People who have diabetes have it for one or two reasons. The first reasons people have diabetes is because their body is not producing enough insulin. Insulin is a hormone that converts sugar, starches, and other foods into energy that the body needs to be fully functioning. The second reason people have diabetes is their body does not accept the insulin their body produces. Diabetes is a chronic disease. There is no cure, only treatment. But however, there are cases it can be preventable or delayed. Please take a look at this handout to see what complications can transpire with the effects of diabetes. Diabetes can have many detrimental effects to the body if not treated. Some serious health issues that can arise from diabetes are blindness, kidney disease, heart disease, and even strokes. Now that we have a better understanding on what diabetes is and its effects, there are different types to this disease. There are 3 types of diabetes: type 1, type 2, and stational. Type 1, which is commonly known as juvenile or insulin-dependent diabetes. Type 1 diabetes occurs when cells in the pancreas are being destroyed by the immune system. As a result, the pancreas loses the ability to produce insulin to regulate the blood sugars correctly. Type 1 diabetes is typically diagnosed in early childhood years. With type 2 diabetes, the body does not use the insulin properly. This is called insulin resistance. At first, the pancreas produces enough insulin to regulate the blood sugar, but over time it isn't able to produce enough to keep the levels normal. Also, type 2 diabetes has a stronger link to family lineage than type 1, which makes up 90% or more of this specific type of diabetes. Stational diabetes is the type of diabetes that occurs with women during pregnancy. This is normally detected within the 3rd trimester, but it typically goes away after the birth of the baby. Stational diabetes should be treated during pregnancy to prevent complications for not only the mother, but the baby as well. People who have type 1 diabetes experience common symptoms such as constant urination, increased thirst, fatigue, weight loss despite increased appetite, vomiting, and nausea. People who have two types of diabetes can experience symptoms that mirror symptoms 1 for type 1 diabetes. Other symptoms they can experience are numbness in the hands, the feet, blurred vision, whole body itching, and poor wound healing. Early detections can be caught at annual blood doctor visits, and there can be diagnosed with they can have pre-diabetes. This is when the blood glucose is higher than normal, but generally not high enough to be diagnosed as diabetes. People who have pre-diabetes can typically develop to type 2 diabetes if their lifestyles are not altered. Now that you are aware of the types of diabetes, it is imperative to take action if at risk. Individuals who are overweight or physically inactive are more prone to developing type 2 diabetes. Studies do show through weight management and exercise, it can be preventable or delayed. Studies also do suggest just as little as 30-minute walks throughout the week can lower the risk of developing type 2 diabetes. African Americans have the second highest rate, which is 13.2%, in being diagnosed with this chronic disease, according to the American Diabetes Association. Given that my father is African American and has type 2 diabetes, I need to closely monitor my physical health style and eating lifestyle to ensure that I am not diagnosed with diabetes. Now that you are aware to how to prevent diabetes, it is important to use this information to maintain a healthy lifestyle. Diabetes is a serious health issue in America, and anyone can fall victim to this disease. While maintaining a healthy or not so healthy lifestyle, it is vital to understand the health risk of diabetes. Given that 9.3% of the country has diabetes, it is time to expand the knowledge of the disease of diabetes. Thank you.